Hello, this is Rick Reardon. In this set of video lectures, we'll be covering the coding of neoplasms, otherwise known as cancer. We'll start with the neoplasm table and cover how the chapter's laid out and talk about other topics important in coding cancer cases. Okay, so we're going to talk about the coding of cancer, coding of primary versus secondary, talk about some of the cancer terminology. But first, let's start with how the chapter is laid out. Chapter 2 of the codebook, Neoplasms, covers code C00 through D49. C as in cancer through D as in um, David, 49. The first set of codes run from code category C00 through C75, and these are neoplasms that are stated or presumed to be primary. Then we move into C7A, which is malignant neuroendocrine tumors, and C7B, secondary neuroendocrine tumors. C76 through C80 covers malignant neoplasms of ill-defined or other secondary and unspecified sites. C81 through C96 covers malignant neoplasms of lymphoid, hematopoietic, and related tissues, in other words, soft cell cancers. And then we have D00 through D09, situ neoplasms. We'll get into what in situ means in just a few minutes. And then D10 through D36, benign neoplasms except benign neuroendocrine tumors. We also continue on with the D codes. We have codes for D3A, benign neuroendocrine tumors, D37 through D48, neoplasms of uncertain behavior, polycythemia vera, and myelodysplastic syndromes, and then D49, neoplasms of unspecified behavior. We'll get into what unspecified behavior is in just a little bit. When we talk about what behavior is, we're talking about these things. First of all, whether it's benign or malignant. Malignant, of course, is what we normally think of with cancer. Not all abnormal cells meet the criteria to be malignant, in other words, cancerous. And when we have malignant tumors, we can think of them in three categories. Primary, which is where the cancer originates. Secondary, which means that it's spread or metastasized from another primary. And then we have carcinoma in situ, which represent abnormal cells that are confined to the inner epithelial layers without invasion, so they're not going anywhere. With benign, we're talking about tumors that don't invade or metastasize. Then finally, we have uncertain behavior and unspecified behavior. And there are subtle differences between uncertain and specified. Uncertain means that pathology can't determine whether it's benign or malignant. Whether it's benign or malignant is uncertain. Unspecified means is that the behavior isn't stated at all. You may want to review figure 5.1 in your book, which talks about carcinoma in situ in cancer. And again, these are cells that are just collecting in the inner layers, they're not going anywhere, and what have you. Carcinoma or cancer tumors are abnormal cells, and typically they have certain properties, including spreading into nearby tissues, invading connective tissue, muscle, other layers, and what have you. There are a whole lot of guidelines, and you'll see these in the textbook and also in the front of chapter 2. And the general neoplasm table guidelines are as follows. You want to reference the neoplasm table first, and we'll get into how you can find it and what you do with it when you do find it. You can kind of think of it as a subset of the alphabetic index, if you will. And then if there's a histological term, that term may be referenced in the alphabetic index first. So when we say histological term, that's describing the histology of a cell. These would be typically words ending in OMA, melanoma, for instance. And then finally, you want to take a look at the guidelines as it relates to treatment directed at the malignancy or treatment directed at the secondary site. And again, when people are seen, they may have more than one primary, a primary and secondary, and all these in terms of how you code them and sequence them. In other words, whether you code the primary first or the secondary code first depends on the documentation and, of course, the guidelines. There are also guidelines for primary malignancy that's been previously excised. Encounters or admissions for chemotherapy, immunotherapy, and radiation therapy, and encounters to determine the extent of the malignancy. Again, more things on the guidelines. Review the guidelines for such things as signs, symptoms, abnormal findings, encounters for pain control, pain management with cancer, and malignancy in two or more non-contiguous sites, and disseminated malignant neoplasms that are unspecified, and malignant neoplasms without specification of a site. Again, all these have specific guidelines, and there's a PDF showing the guidelines on Canvas that you can review and actually download. And again, as talked about, we have sequencing of neoplasm codes, including such things as complication for surgical procedure for treatment of a neoplasm and pathological fractures due to neoplasms. One thing that's important for coding integrity and reimbursement and compliant coding is the difference between coding for a current malignancy versus a personal history of malignancy. So be sure that you read that guideline and understand what it's asking you to do. Also, in terms of leukemia, multiple myeloma, malignant plasma cell neoplasms, there's specific guidelines, and then guidelines for aftercare. More guidelines on neoplasms. Notice some of these. It gets into a very finer level of detail, and these are the types of things that sometimes get updated yearly. Follow-up for completed treatment of malignancy. Prophylactic organ removal for prevention of malignancy. Malignant neoplasm associated with a transplanted organ. Breast implant associated with anaplastic large cell lymphoma. And then secondary malignant neoplasm of lymphoid tissue. Take a look at the neoplasm table. It's organized into 7 columns. The far left column's the site. And then the next six columns are codes for whether the neoplasm is malignant and a primary, malignant and a secondary, carcinoma in situ, benign, uncertain, and unspecified behavior. Let's take a look at this and we'll walk you through it. And I'm going to use an older code book because I like the graphics a little bit more, a little bit easier to read. So we'll show it to you right now. Okay, here's the neoplasm table. And as discussed, this is all the sites are in alphabetical order, starting with A for abdomen. And then you can see malignant primary, malignant secondary, carcinoma in situ, benign, uncertain behavior, and unspecified behavior. So let's take a look at that again. And so these are all in order. Malignant primary, malignant secondary, carcinoma in situ, benign, uncertain, and unspecified. And when we look at the neoplasm, we see a dash following a code category. That means it has a fifth character for laterality. And we don't ever just code off the neoplasm table. We have to go to the tabular and validate the codes. ICD-10-CM also classifies neoplasms by topography, and histology is used to describe certain malignancies. When we talk about topography, we're talking about a description of a region or a special part of the body. Histology is dealing with the cell structures. So, for certain neoplasms like malignant melanoma, histology is included in the code category in the codes. When we talk about morphology, we're talking about the physical shape or size of the cells themselves. And again, as noted, we should always validate codes in the tabular, but especially when we see a dash, because that's telling us there's some laterality involved. It's either right or left, right? And the tabular must be reviewed for the complete code. So you never want to code just off the neoplasm table. So let's take a look at how we could find the code for malignant neoplasm, upper outer quadrant of the right female breast. So here we are, neoplasm by site, and you can see right here, we go to breast, and then where in the breast? Upper outer quadrant, and we wind up with code C50.4, and we see a dash. That means we have to validate that in the tabular. And you can see that right here. Note that with your code books, anytime you see this little message, it's telling you you need more characters. In this case, a fourth, fifth, sixth, right? So here's the correct code, the C50.411, malignant neoplasm of the upper outer quadrant of the right female breast. I hope you found that useful. We'll do a few more of these. And in our next video lecture, we'll get into more of how we can code other aspects and other different types of malignant neoplasms. We'll see you then. Bye now.